I presented the phase 2 basket trial of Ado-trastuzumab emtansine in patients with HER2 amplified salivary gland cancers. So in this study we looked at this very rare disease. Salivary gland cancers account for about 0.8% of all cancers, and within this group the salivary duct cancers are an aggressive subtype that's associated with metastatic disease and poor prognosis. There's no established standard of care and no FDA-approved therapy for these patients. So we looked at, from a molecular angle, HER2 amplification turns out to be quite common in this rare tumor, and it's 8% of HER2 amplified of salivary gland cancers and up to 30% of salivary duct carcinomas. And we looked at an FDA-approved HER2 antibody drug conjugate called Ado-trastuzumab emtansine to look at its activity in patients with metastatic salivary gland cancers that are HER2 amplified. And of the 10 patients we accrued, we saw 90% were male and with a median age of 65. So it is a disease of predominantly older men, although I did have a young woman on this study, so it's by no means entirely exclusive. Those patients were heavily pretreated with a median of 2 lines of prior therapy, including HER2 targeted therapy with trastuzumab and pertuzumab, as well as anti-androgen therapy. Now, out of those 10 patients, we saw a 90% response rate. Now, overall response was our primary endpoint, and this was measured by RECIST version 1.1 or PERSIST based on metabolic response on PET scans. We allowed that because many of those tumors metastasize to bone and lymph nodes only, and therefore if they has to be go through RECIST, we would have to exclude many patients. So right to include them, we allowed PERSIST, which is also a widely used response assessment tool. So by RECIST or PERSIST, we saw a 90% response rate, and we looked at the 2 ways of measurement separately, and on cases where we had both RECIST and PERSIST, they corresponded very well, and the responses were also very deep. So overall, this was a good response. We then looked at the secondary endpoints of progression-free survival, duration of response, and toxicity. We saw a very nice duration after a median of follow-up of 12 months. The median duration of response or progression of free survival were not reached, and some patients were still responding to therapy after 2 years of treatment. So very durable efficacy. And in terms of toxicity, this drug was well tolerated. We only saw predominantly grade 1 and 2 elevated liver enzymes and thrombocytopenia, which is consistent with what's known in breast cancer. We also looked at the biomarker HER2 amplification. We identified them through next generation sequencing, but they correlated very well with FISH in terms of looking at the HER2 CEP17 ratio on the FISH. And with next generation sequencing, we used a fold change of 2 or greater. That's a copy number fold change being the cutoff, and that correlated very well with FISH, and also correlated very well with immunohistochemistry 3+. So overall, we saw outstanding responses. We're still doing further work to look at the biomarkers, the translational work on cell-free DNA, looking at acquired resistance mechanisms. We're looking at also dimerisation assays to determine the degree of dimerization and HER2 receptor internalization that will suck the antibody drug into the cancer cell to render the cell kill. While we're looking at it, to me as an oncologist, what's most important is that with this kind of outstanding results, we'd like this drug to be made available to more patients. To get there, we need to finish the trial. This trial is ongoing. We've only accrued 10 patients, such a rare disease, and I hope to get the message out there that salivary gland cancers, although there's no approved treatment, we need to test for HER2. And if it's positive and for amplification, then these patients should ideally go on a clinical trial. And this trial is currently open at Memorial Sloan Kettering. We hope to accrue a total of 24 patients. We needed to reject null hypothesis by having 6 confirmed responses. We already achieved that, so that's why we're reporting the trial early, but we still need to do the work to generate more data and hopefully get this drug FDA approved, and that would be a win for all patients. Currently, there is no established standard of care. In early disease, surgery is still the mainstay of treatment, along with chemoradiation as adjuvant therapy or neoadjuvant therapy. But once they become metastatic, the current standards, there's no established standard, but the chemotherapy and anti-androgen therapies are considered as options based on some retrospective case series and also some limited phase 2 trials. In HER2 amplified salivary gland cancers, there is a trial that was just published last year looking at the trastuzumab plus chemotherapy, and that showed encouraging response rate, also validating that HER2 is an important target in salivary gland cancers.